and the nature of feet. All right, so we're going to treat this in two parts, and we'll do the exact same thing with hands next week. We'll go over some basic relationships of feet now that you can kind of use in a cookie cutter type of way and really simplified versions for 30 seconds, 2 minutes, 5 minutes. And then something that you can also use to elaborate upon that in the second half of the class. That will be equally useful in, say, 2 minutes, 5 minutes, but also give you a way of expanding beyond that when you have a little bit more time to develop the pose. Okay, so key relationship, right, of the foot, and let's just relate this to the leg to begin with, right? So if this is your leg from the front, and we've got this high outside, low inside relationship that we have already gone over in terms of the generic relationships of feet. And so bulge of the hamstring a little bit lower than the bulge of the glutes, bulge of the quad on the inside, a little bit lower than the bulge of the quad on the outside, bulge of the calves on the inside, a little bit lower than the bulge of the calf on the outside, and even the dip on the inside of the knee being a little bit lower than the dip on the outside of the knee. Sorry, so we have this consistent high outside, low inside relationship with the leg. And obviously that's the same from the front and the back. As I mentioned before, is like the overall shape of the foot is from both the front and the back is kind of this. That's a really easy way of thinking about the foot. And the most important part of that is that the inside of the foot, the inside of the knee, and the inside of the thigh all basically line up along each other, right? So that the outside of the foot projects outwards like this. So that's one key aspect of the foot. The other key aspect of the foot is that this relationship here changes at the ankle. The inside ankle on the top of this overall shape, right, AKA the head of your tibia, right? So head of your shin bone always sits higher than the outside ankle, AKA the head of your fibula, right? So that relationship always exists, even if you don't see that relationship. And by seeing that relationship, I mean, because of the format that we're drawing in, because the images are small, you might not physically be able to see it, but also because of the perspective or the position of the pose, it might not look like this. Maybe the structure of the model in question's foot, right, has changed or is different as well, like say collapsed arches, right, etc. Even if it doesn't look like this, draw this, right? Because this is what's going to make your drawings look accurate, right? And if, sometimes, right, depending on the things that I've just said, if you draw it accurately, right, it's not going to make your drawing look more accurate. It's actually going to do the opposite, right? It's going to make your drawing look structurally inaccurate. Okay, so this is the first relationship of the foot that we want to try and capture, right? Outside ankle always being lower than inside ankle, right? So a big part of the foot is what it's attached to, right? The ankle and the lower leg. So just like this only feels as good as what it's attached to. Same thing with this. These two things, right, only feel good as is one versus the other. And now what we're trying to do with this initial shape is add as little as possible to it in order to make it feel more foot-like. So this shape already does a lot of that work for us. The only other thing that we need to really think about now, right, is the arc of the toes. Right? So rather than having a flat line along the bottom of the foot, right, from the front, we can arc the toes out and have this interior section drop just a little bit lower, whereas the exterior section starts that arc. And then here we have essentially an oval representing the front of the big toe. So let's blow this up a bit so that we can get a better look at things. There's the basic shape of your foot. There's the basic shape of triangular calf coming down. Your tibia, right, would be a projection off of that. So this is volume that's added to that shape. So is your fibula. And again, those things have that angle relationship. Your toes will be then doing something like this. and then your big toe just projects a little bit further beyond that. This is more than enough to try and get across the idea of the foot inside 2 minutes or 5 minutes. Now your toe, we're going to talk about the shape or these individual shapes of the foot simultaneously now because it's easier to do. The outside of the foot and the inside of the foot look exactly the same, right? And in their basic shape. And that basic shape is this. You have a triangular wedge, right, that's elongated, right, with a peak that basically makes room for that triangular shape of your calf to come down into, right, and provides room for your ankle. This shape is going to be identical from both inside and outside. Now, what's key about this shape, right, is this space right here. This space always moves backwards like that, right? So skeletally, your foot, it looks like this, where you have essentially a bone called your calcaneus, right, or your heel bone that sticks back or that moves backwards like this, and your Achilles tendon comes down and attaches to it. This is what is mimicking that. So when you put in a foot that looks like this, with the leg growing straight up out of it, it looks weird, right? Because it doesn't have that. So we need this there, both from the inside and the outside, as a way of making that simple shape feel a little bit more accurate. Now, from the inside, your big toe, right, this thing here has kind of this shape to it. It kind of swoops out like this. So you can soften the front of that triangle a little bit by putting in this movement here, as opposed to what will look like, or what the foot will look like from the outside. And then likewise, your bones from the inside of the leg move upward like this, or the inside of the foot move upward like that, and that physically creates an arch, which means that you're going to have, right, basically a shadow shape, right, or you can physically draw in an arch in that area to make that feel more inside-y, so to speak. There'll also be a subtle shadow that drops underneath, right, your tibia. And your tibia, right, will basically be taking up the entire front half of this initial shape, right? So there'll be a light shadow or even just a check mark that you can kind of put in there as a representation of the ankle. Now, even though there is this arch from the inside, if that foot is flat on the ground, treat that line as if it's flat and then put the arch in above it. Because you can still going to be able to see the outside of the foot, right, that's up against the outside of the, or up against the ground, even though the inside of the foot is up off of it. And this flat line underneath that will help to make it feel like the foot's experiencing a sense of compression up against the ground. You know, obviously this is a simplified version, right? Generally speaking, you're not going to be looking directly at the front of the foot or directly at the side of the foot. You're probably going to be able to see a portion of the inside, or sorry, the portion of the top of the foot. My suggestion would be, especially in short poses, is to ignore that, right? Ignore it because it's easy enough to add to this after the fact, and we'll go over that later on, right? And make it feel like it's more prospectively accurate. It's easy enough to interpret this, right, as a way of making it feel more prospectively accurate, right? Nobody is going to know, right, one way or the other, whether or not a foot actually looked this way or not. Right? The idea is to convey a convincing sense of a foot as opposed to what the foot actually looked like in that position. Right? And the same thing from the outside. Right? That overall shape of the foot is going to look exactly the same. That ankle is still going to be in exactly the same spot. This thing is still going to be doing exactly the same. The difference now is that the outside of the foot doesn't have this arch. It's just a flat space. Right? Now, when we develop this a little bit further in the second half of the class, right, there will be salient differences, right, between what the outside and the inside look like for right now, or look like then, but for right now, this is just flat. Big difference with the ankle on the outside is that because of the nature of what the ankle looks, or because of the nature of how the ankle pushes up against the surface of the skin, this is quite a bit more pronounced on the inside, right, and creates a significantly deeper shadow underneath that. right? Which means that you can get away with not putting the check mark in here, right? Or the shadow in from the inside and exaggerate it from the outside, right? And why that's the case will become more clear when we go over a more in-depth version of not only the foot, right, but also the lower leg in the second half of this class. Now, the big difference, though, is, or another big difference, right, is in and around the feet, or in and around the toes. Your big toe has an overall look like this, right, in terms of its shape. Your little toes are doing something significantly different. All of your little toes have a shape that look something like that. There are variants as you move from your second toe towards your pinky toe, but they all have this general structure, right? Which can be simplified into something that looks like that. That's what we're trying to do to your feet from the outside, right? Is put in this ledge-like experience there for the closest to, or for the toe closest to you, and then ghost in, right, this swooping toe on the other side of it, and implying that there are other toes in between there, right? We don't need to draw all the toes. Again, we just need a convincing version of a foot. Okay, so we're moving from that direction to that direction as we start to stack those toes up on top of each other. So this oval from the front, right, will convey this type of feeling. And then the ends of all the toes will also arc out along the same arc as the ends of the toes. And when we come out to start breaking these things up, all we're trying to do is now put in that ledge-like experience. Now for the front of the toe, you can accentuate that by putting in, right, another arc, that arc representing the front or the front of the nail. And for your individual toes, you can basically just divide this up into a series of piano keys. Right? This is more than enough, right, for a 5-minute foot, right? And then, like I said, we'll expand beyond that, right, in the second half of today's class. Okay, so these are 3 cookie cutter versions of the foot that build on those really basic shapes of this and this as easily as possible. The back of the foot is equally easy, if not easier, right? Because this shape still does most of the work, but then just like your toe extends beyond the bottom of that triangle, this section here extends beyond the bottom of that triangle there. This extension here is this portion here. And what this is doing is basically giving us a sense of projection into or back into space or forward to us in space, right? So this is making this feel closer than that, and then vice versa here. So this basically takes care of the foot altogether, and we can make the foot in general from the back feel even more accurate by not really thinking about expanding the foot so much, but by taking this initial shape that we've done with the lower leg and extending it into kind of a bulge at the bottom, right? So it's kind of like you've got an upside down bowling pin, right? And that's what your lower leg looks like, because this shape here will bulge a little bit into a triangle as that Achilles tendon attaches to that inside, or as it attaches to that bone. So you can then just connect these two things, right? And then that gives you the outside of the foot. Now, obviously, you're not going to be able to see just the front of the foot or just the back of the foot in a simplified form. You're going to be able to see a little bit of the inside, a little bit of the outside. So if I want to make this feel like it's turned a little bit more towards the inside, rather than, trying to interpret this, I start with this, right? But then maybe I just add a little chunk of space there. That will make that feel like I can now see a little bit of the inside of the toe, or the big toe. And then again, remembering that my ankle on the inside has to sit lower than my ankle, my ankle on the outside has to sit lower than my ankle on the inside. So that's adding volume to this initial shape here. Okay, so this is my outside, that's my inside. and that's all that my foot needs to be, right? Especially for say 30 seconds, 2 minutes, right? We can probably get a little bit more inside 5 minutes, right? But not much more. So all that's really left now is a bottom shot of the foot and a top shot of the foot. Top shot of the foot is super easy. Inside of the foot does the exact same thing as the inside of the foot does here. It's just a straight line from heel all the way to the end of your big toe. The end of the heel is quite a bit narrower, right? Let's say that we divide this up. Let's say that we make a long rectangle out of this. And then at the halfway point here, we double that rectangle. And then connect that halfway point back here. That's what the shape of your foot looks like. The longest section of your foot is going to be your big toe, middle toe, or second toe, and then that arcs back towards your pinky toes. And then the arc of those pinky toes follows the arc of all those toes follows the arc of the end of the toes at both at the end, or the proximal, right closest to you, and distal end of the toes. All of your toes, for right now, they just point straight forward. This is a lie that's close enough to the truth that we don't really need to expand upon it all that much. We'll get to it later on. This is all your foot is from the top. Right? This is basically your superhero boot. Batman wears that boot, Spider-Man wears that boot, Superman wears that boot, Wonder Woman wears that boot. For some reason, Aquaman wears boots and he wears that fucking boot. All of your superheroes wear the exact same boot. So we're more just kind of putting in a shape, getting used to what does that shape look like, right? And putting that shape in kind of like a flipper, right, for a top version of the foot. The underside of the foot shares the exact same shape, but it's got a bunch more landmarks to it that are useful to put in, right? So this exact same shape exists, but now the underside of the foot has a heel section that's basically an oval, a ball section that's basically another oval working in the opposite direction, and then the underside of the big toe is kind of like a squash, a soft triangle. And then that soft triangle connects to the outside of the foot along an arc. And then the outside of the ball connects to the outside of the heel of the foot, kind of like an old school telephone receiver handle. This side here, or this section here, is all arch. Right? There's some nice details that you can put in, right, in terms of putting in wrinkles and shit in here, right, to make it feel more foot-like. Likewise, this arch coming off the big toe, you can populate that with the cherries of the underside of the little toes, as long as there's a gap left in between there and the top of the ball of the foot. Okay, so those are your kind of like 6 generic positions of the foot. So go ahead and screenshot that. Because what's left now to do is to basically interpret those positions, should they not conveniently fall into one of these 6 different categories, right? And this happens obviously all the time. Where, you know, a really common position of the foot would be something that you guys have seen, right, a number of times already, where say you get a foot that's in this position here. Well, all that position is, inside or outside, is this overall shape down to the toes, and then this overall shape of the toes. That shape, seen from the back, right, now might be something like this gesturally, right? So hardly any different. But now when we start to put in, right, an idea of the back of the foot, right, and a little bit, say, of the side of the foot, and a little bit of the toes, a little bit of the heel, a little bit of the arch, a little bit of the ball of the foot. So now I interpret that, right, into something that's a little bit more 3-dimensional. What would that look like from the front, right? Another common position, right? It's like, well, first off, I've probably got some foreshortening of this thing moving backwards, right? So that's an issue in and of itself, but the front of that foot would just basically look like that, right? That overall shape that I was talking about. right? And then over top of that, you know, those toes coming forward. Right? And then as a way of, you know, making that feel a little less shitty, putting in right this shape for the front of the big toe, these shapes for the front of all of the other toes. Okay, so there's a fair amount of interpretation, right, of this, right, but easily added onto just like this. If I want to make this thing turned in a little bit like that, then I just add this little chunk of space here. If I want to make this thing feel like it's turned out a little bit like that, then I can just add that little chunk of space there. What we're trying to do is, again, use this stuff to do as little work as is possible towards something that, to be fair, is quite complex. So as a general rule, try and draw the easy foot first. So Emily, would you mind taking on a pose that, say, has your foot in one foot in an easy position and another foot in a more difficult position, say like something foreshortened or.
Do you want a close up of the feet or the whole body?
Whole pose, please.
Whole pose? Okay.
Great. Okay, so none of this stuff, again, affects your gesture. All that we're trying to do inside of a gesture is have something that resembles a foot structurally, as opposed to something that is detail oriented with respect to a foot. Okay, so at the beginning of my gesture, it's just something that's loosely like this and something that is loosely like that, right? Nothing more. They're just placeholders, right? Well, again, what we don't want is something like this or some shit like that, because now I can build on top of this, right? Now, again, I'm building on top of that, thinking about it as an extension of other stuff, namely the lower part of the body. And so just like your pelvis and your upper leg are related to each other, same thing with your lower leg and your foot. Right, so what I'm doing now inside of, say, 2 minutes is starting to solidify this shape, but solidify that shape in relationship to that calf. Right? And that's kind of all I'm really looking for inside 2 minutes. Right? And then likewise, right, with this foot. All I'm trying to do is solidify the relationships of upper leg, calf, and foot to each other and make the shapes that they're based on a little bit more accurate. Okay, so that's all I'm doing at that stage. Now, from that stage forward, and I'm just going to blow these up, right, as a way of making this a little bit more obvious. All I'm trying to do now is take advantage of, again, the characteristics of foot in general. Okay, so I know that this is there, that's there, that's there. This has to be there. I know that this has this general swooping motion, right? And that there's an arc that comes up like that, and then that's pressed up against the ground so I can solidify that. So in the small version of that, you know, that's what that might look like. So I'm effectively just ignoring the fact that I can see a little bit of the outside of the foot. What you can do, right, though, is use that position as now a way of blocking in the rest of the outside of the foot that you can see in front of this. Same thing here. There's my initial gesture. Starting to solidify that shape, right? And solidifying it with respect to the calf as well, so that those things feel like they're attached to each other. And now starting to basically block in that overall shape and take advantage of the fact that I know that the big toe has to be there, that the little toes all arc out, and that they have a little bit of a more ledge-like appearance, and then dividing those ledges up, right, into individual toes, and maybe even putting, right, an indication that there's a curve on the front of the big toe. When I do all that here, because the drawing is relatively small, you don't have to do too much, right, as a way of getting a convincing sense of a foot across. Thank you, Emily, that was great. Okay, now keep in mind that this is the size of my hand, right? I'm not a particularly small person, right? So my legs, right, are at least the length of my hand here. Here, my foot's almost half the size of my hand. Now, even to get into a remedial level of detail like this, I need that drawing to be at least that big. So for those of you who are, say, doing this pose and are making that drawing this big, okay, trying to draw this stuff or this stuff right inside that amount of space is going to be a nightmare for you. It's basically impossible, right? And you're just asking for frustration, right? Because it's one small flick of the pencil away from just being a smear of graphite or charcoal or Prismacolor or whatever it is that you're using. And basically, that's a way of saying is like, I need this space and I need to draw bigger the more detailed my sketch gets, because as we start to get right more into the detail of any particular area, the space that I have available in order to do that is going to basically determine how successful I'm going to be able to communicate that information, right? Regardless of whether or not it's from a profile, right? The front, the back, right? The whatever, it doesn't make any difference. Okay, so this is a long way of, right, strongly suggesting that as the pose length gets longer, right, we gradually want to start to expand the size of your drawing, right, so that it gets physically easier to do this stuff. But keep in mind, even when we're doing it, significantly larger, these aren't feet studies. You're not drawing Emily's feet. And this is a big problem that people generally have, not only with the body, but especially when we get into the more expressive areas of the body, hands, feet, face, etc. You're not really drawing Emily's feet. You're drawing a foot, right, in that position. I mean, less so with the face, but definitely with the hands and with the feet. It just makes that piece of business significantly easier. Okay, so again, the foot is roughly triangular, right, in terms of its overall shape, right? So from the front, we've got this, right? From a profile, we've got this, right? And from the underside and from the top, we've got some shape that, kind of looks like this. All of these are, more or less unsatisfying in terms of developing a foot that looks more like a foot. And so, not surprisingly, there's three-dimensional versions, right, of this, which will help to interpret these basic shapes, right, and make them a little bit more user-friendly. So, if we're looking at, say, this shape simplified from the inside, one way of thinking about that shape would be like this, right? And I've mentioned in the past, right, that if you want to do anything, right, to help yourself get better at this class, outside of this class, right, drawing shit like this as, mind-numbing as it can become, right, at times. If you're just doodling shit, right, while you're, doing other stuff, this is good stuff to doodle, right, and try to, change the orientation of that thing. Because if I were to change the orientation of that thing, say, to the outside, well, it's the same basic shape, right? But now, you're obviously just looking at it from an entirely different angle. Now, what we want to think about this thing is having kind of like an area up here, and I've really done this very well in terms of scale, right? Where, another geometric shape is going to be walking into. Right? This geometric shape being, your lower leg, something along those lines. Now, if we look at this thing from the inside, right, there's again some characteristics that we can look for. First off, we know that the inside of the leg is going to have, right, a bit of an arch to it. Now, as I mentioned beforehand, that arch, right, is created by your calcaneus, right, sticking up against what are called your tarsals, right, your tarsals, aka your ankle bones, right, which are different than the ankle bones that we might say, right, that relate to the tibia, right? So a part of that, right, is a muscle called, or a bone called your navicular bone, right, and your tarsus, right, and then you get a bunch of cuboids and a cuneiform, right, chunk here before you get into your metatarsals, which are all, right, your toe bones or your foot bone, so to speak. It's the foot equivalent of these things here. These are metacarpals. These are carpals. These are these are tarsals. These are metatarsals, right? And then your toe bones, right, are called, and your finger bones are called phalange. So when we start to capture this here with this, right, this is one way of breaking up that inside shape. One peculiar characteristic that your tarsals and your metatarsals have, especially as they come in contact with each other, is that they've got a bit of an arc to them. So what that allows us to do to this shape is to soften that shape, right, with a bit of an arc that basically makes a cradle for your shin bone, right, or your tibia and your fibula to sit on top of, right? So we can even soften this simplified shape into a bit of an arc on top, right, and then rest those two shapes in on top of that, as we're making that feel a little bit softer. Another thing that you can do for the big toe area is think about the big toe as basically a thing in and of itself, and it comes down to a landmark. That landmark is this thing here. That's the junction point between your first metatarsal and your first phalange. Right? And what this volume does, right, is essentially what all the volumes do when we're dealing with joints. All bones, when they come to their terminal end, flare, right, which means that they create a bigger volume than the shaft of that bone. Right? This is particularly true of hands and feet, fingers and toes, right? Because outside of, like, say, fat and abuse starting to accumulate around your knuckles, right, as you know, you gradually just get older and shittier, right, your bones, right, are going to do something like this. What this means for us is that we can use that really basic shape as a way of starting to contribute to a volume that is just for the big toe. Because the big toe has a tendon called your hallucis longus, right, that comes down from the front of the shin or across the shin, right, and then runs all the way out to the end of the big toe, which is why your big toe is so articulate compared to your other toes. Right? And then as we come down off of that, we again have this oval type shape that now projects off of there in this kind of swooping motion that we already talked about. And then inside that, we have another landmark that represents this junction point. Right? And what that creates for us is the capacity to take this shape here, combined with this, and combined with this, and now start to use the contour of that thing to get a sense of what the top of that big toe looks like. Overlap that big toe with the nail bed itself as it starts to move back towards this first junction point here. And then basically treat that as a little tent as it starts to round over top of the knuckle of the big toe. And then likewise, that same thing is going to happen underneath the toe, except now we're going to have a different kind of overlap. Now we get an overlap as this section of the toe moves like this. And then when we're looking at it from this direction here, that's going to overlap this section here, which then just moves back up into the arc of the foot. So basically those simplified shapes then, you know, allow us to again get into a routine of our, all right, well, I know that the foot looks like this. So irrespective of what position the foot is actually in, I can start to essentially just put in that formula, right? And I get something that looks kind of like a big toe. Now, this muscle is coming up, right? And importantly for us, it goes over top of the muscle that's coming off of the heel. So you get a convincing overlap there when you start to put that in from a different direction. or from a more complicated direction. So one way of interpreting this in a short study might be to do something like this. Say that you're dealing with a gestural leg, right, that comes down, right, and isn't really frontal, isn't really profile, right, but is just in some sort of like irritating in between area. One way would be to simplify it like this to begin, and then add a little chunk of space on the side of it, as I was suggesting beforehand. Soften. Oops, I got that on the wrong side. That's why that looks weird. Soften the top of this thing. Put in that generic relationship. Accentuate this. And then all of this, and then just make sure that this overlaps that properly. Right? And now we've got something that looks like it's in a bit more of a 3/4, right, position, as well as a bit softer. Now the little toes, right? The little toes, right, and this area here present a particular problem. What we have up here is something that gradually transitions from something that's kind of curvy, that representing this area here, to something that's kind of flat, that's representing the ledge-like appearance of the little toes that are all coming out like this and arcing backwards at the same time. Okay, so this transition here presents a peculiar problem of moving from curved to straight. One thing again, right, is right, just getting overlaps right. Now again, all overlaps create depth, right? So anytime that you're putting an overlap in, right, you're creating a natural sense of depth in your drawing. The trick is to get the overlaps correct so that they actually mimic the structure of the body. Well, because this is going to the outside of the foot, that means that all of the tendons that are coming off the front of the shin that we'll get to in due course have to come in front of that thing, right? And then those things curve out right into the arc of these metatarsals. But there's also a muscle on top of that that helps to contribute to that. You have big tendons here and big muscles in your forearms that control the flexion and the extension of your fingers. You have the same thing in your hand, in your foot, except that one, right, is a little bit more visible on the outside of the foot, which contributes to this curve. Those aren't visible, right? Or sorry, you have smaller ones that control like really dexterous ones like this in your hands that are buried underneath, that are buried inside your fingers, and you can't see them because they don't bulge. One of those, though, that controls the dexterous movement of your toes, right, is inside this area that contributes to this arc. So this arc then comes in front of the outside of the foot, which then has to go in behind it. And then likewise, your toes will gradually, or as your foot starts to bulge out into these contact points, will also start to bulge out and flatten as they start to move out into the ridge-like appearance of the little toes. Now your little toes again can be treated just like, as a really simple version, they can be treated just like this. Okay, that's one way of dealing with your little toes, right? And then breaking that up into individual sections and just making those sections feel like they get smaller as they get further away as a way of inflecting recession. Another way of doing that is to take this same general shape, right? But now introduce a step into it. Irritating, right? That perspective starts to become a player in this particular conversation. Okay, and then basically dividing that up, right, into 4 equal chunks, but now you've got a step that is associated with those chunks. Another way of doing this would be to do a similar type of thing, right? But now offering it up almost, right, as a curve, right, where those toes are coming back like that and gradually receding off into the distance, right? And again, we can introduce a ledge into that as well as a way of softening that a bit. Right, this one, once you is the more difficult to do, but ends up being a little bit more reflective of what the toes actually are, because they're not physical piano keys like this. They just have a very different feeling than the big toe. Right? Your first toe basically kind of looks like this, right, with the nail bed sitting on the front of that thing. But your little toe, right, basically just looks like this. It's this shitty little peanutty type of thing. Right? So that starts to more accurately reflect that end. This probably here more accurately reflects this end. But when you're doing this at speed, right, it doesn't really make too much of a difference, right? Because inside, say, 5 minutes, if you just took a foot, right, and did that to it, that already starts to feel quite a bit more developed as a foot. Likewise, if you know that this has to come down to the side of the leg, right, and then the calves have to go in behind that, and the heel by necessity has to come in behind that, just by putting that sense of overlap in there, that also starts to contribute to the accuracy of the foot. And there's a series of tendons and shit that come down in front of this as well, right? But that's, you know, beyond what we need to do at this point. Okay, this just gives us a bit more time, or a bit more of an ability to develop, right, the foot at a greater degree of complexity than, you know, these things allow. Right? And if we think about this as, again, contours, this also, right, gives us a way of controlling this irritating piece of business as this starts to flatten out and change contour as you come into, right, one side of the foot or the other. Now, especially is like as you come up here, this whole area here starts to flatten out quite a bit as well. So while this gets quite round here, this starts to kind of more get flat as we come into this area, although is a bit of a bulge, right, as you get into the heel. Right. If we look at that same thing from the outside, that same arc is present. The ball of that muscle that I was talking about exists over here. This arc then starts to contribute, right, to a bit of the bulge that you can see over the top of this area. This same contour starts to occur as I come across the foot. This overlap of heel, ankle, calf, right, starts to occur again, except from the outside, the tibia really isn't all that visible because it has less of a projection, right, at the ankle side, right? So that's something that you can probably just kind of leave out. But what does become obvious is that your tendons now come across your shin like this, and then they either morph into, right, this bulge, or go behind or go in front of that bulge, because those are bones, right, that are sitting on underneath those tendons. Now on the outside of the foot, you have, think of, right, the outside of the area of the foot as being one long tube that has a volume to it. It's a bit of a simplification, right, because it bulges in the middle, because that muscle has, right, another attachment point right about the halfway point or halfway mark. So what we get in here is a contour as I start to shift across the front of the shin, dipping into the head of the fibula, disappearing behind the fibula, dipping into the cavity in behind there, and then bulging out over the top of this muscle on the outside of the foot. Your big toe, right, is doing the exact same thing from the outside as it does from the inside. So I'm just extending that shape a bit and then moving this arc forward, and then putting these things in, but now in reverse. Now, importantly, the outside of the foot is narrower than the little toe. So that little toe is going to overlap the outside of the foot from this position, regardless of which one of these different ways that you communicate it. And again, because overlap creates depth, if I just do something like this, where that overlaps this, this goes in front of that, this goes in front of that, and then this goes in front of that. Again, I get a pretty decent, right, version of a foot just by putting that in, right? And then nails sitting on the front, right, of these little guys. So what that might look like from the front, if I blew this up, is I get that big ball there, then this big ball here, representing an overlap. And there's lots of different ways that I can draw.